It's your health. More young and healthy pregnant women, most of them unvaccinated, are ending up in hospitals from COVID-19 during the Delta spike. Dr. Jessica Parrott with Overland Park Regional Medical Center is here to discuss vaccine hesitancy among pregnant women. Why do expectant women run a higher risk of severe illness and pregnancy complications from the coronavirus?
Unvaccinated pregnant women are having a much higher chance of getting severe disease. And the reason for that is because during pregnancy, there's changes that happen in your body that weaken your immune system. These changes, while great for growing a baby, make you more susceptible to having severe disease.
How does having COVID impact delivery and the baby?
When a pregnant woman comes in and ends up having to be hospitalized because of COVID, it's most often because they're short of breath and need oxygen. Sometimes they can really quickly decline if it's felt that either mom's chances of survival or even baby's chances of survival are going to be better if we deliver the baby, then that's what we're going to do. However, if we have to deliver baby really early, that baby is also going to have all the risks associated with an early delivery.
Are the COVID vaccines safe and effective for pregnant women?
Definitely. There's been a lot of reluctance amongst pregnant women to get the vaccine, and a lot of that is because pregnant women were excluded from the original trials. However, since the emergency authorization of the COVID vaccines, there's been registries as well as studies being done on the pregnant women who have received the vaccine or those that have gotten pregnant shortly after receiving the vaccine. And thus far, there's been no evidence to support increased risk of miscarriage or increased risk to the fetus. The other thing that they are finding is that by getting the vaccine while you're pregnant, you're actually able to pass on those antibodies through the placenta to your baby, and these babies are actually being born with antibodies against COVID.
What do symptoms of the Delta variant look like?
So with the Delta variant, it's going to be tiredness, shortness of breath, fever, cough. The biggest difference with the Delta variant is we're seeing more younger people get sicker quicker.
Anything else you'd like to add, doctor?
Yeah, as long as we are having people who aren't vaccinated and the virus is continuing to spread, then we're going to just have more and more variants develop, and each one is probably going to be worse than the last because the virus is going to adapt and mutate so that it can, so that the vaccine eventually will become less effective. But the more people we have vaccinated, the less it can spread and the less it has a chance to mutate and form new variants.
For more stories like this, head over to our website, kctv5.com/HCA Midwest.